All right, today we are peeling back the skin on a nutrient you think you know to uncover its, well, shocking secret. We're talking about potassium, and we're going to find out how it literally powers the electricity of life itself.
So, you've probably heard it a million times, right? Eat a banana, it's got potassium. But have you ever actually stopped to wonder how? How does a mineral in a piece of fruit connect to something as critical as your heart beating every single second of every day?
Well, the answer is surprisingly electric. Turns out it's all about a hidden electrical charge, a tiny little battery that exists in pretty much every single cell in your body.
And look, we always jump to bananas, but potassium is basically everywhere. It's in tomatoes, potatoes, even meat. But its job goes way, way beyond just being a part of a healthy diet. You see, potassium is what's called an electrolyte, and man, it is a true multitasker. It's keeping our fluids in balance, it's letting our nerve signals fire, it helps our muscles contract, and yeah, that includes the most important muscle, our heart. It even plays a role in blood pressure and bone health. The bottom line is, it's absolutely essential for keeping us up and running.
Okay, so let's get into the real core of this. Because if you can grasp this next concept, you'll understand pretty much everything there is to know about potassium. I like to call it the Great Cellular Divide.
Here it is, the single most important fact you need to know. Potassium is the major intracellular cation. Now that sounds complicated, but it's not. Cation just means it's a positively charged particle, and intracellular means inside the cell. So all that's saying is that potassium is the main positive stuff found inside our cells. The key word to burn into your brain is inside. And what's really incredible is just how big this divide is. I mean, look at this chart. The amount of potassium inside our cells is about 30 times higher than the amount outside. And let me tell you, this is no accident. Our bodies are working around the clock 24/7 to maintain this very specific imbalance. So you have to ask, right? Why? Why go through all this trouble to keep 98% of all the potassium in your body locked up inside your cells? Well, the answer? This is the big aha moment. It's the secret to how our cells generate electricity. Let's walk through this step by step. So first, because there's so much potassium crammed inside the cell, a little bit of it is always trying to leak out. It just wants to go where there's less of it. But as these positive potassium particles leave, the inside of the cell starts to become negative. And what does a negative charge do to a positive charge? It pulls it back in. So you get this perfect little tug of war. And the result of that perfect balance is this. You end up with a stable negative electrical charge across the cell membrane, right around -90 millivolts. This is called the resting potential. It's like a coiled spring or a loaded battery, just sitting there, ready to unleash its power to fire a nerve or contract a muscle in an instant. So our body has built this incredible electrical grid powered by every single cell. But it's delicate. So what happens when this balance gets disturbed? What happens when we fall off this potassium tightrope? Well, the number we really watch is the potassium level outside the cells, in our blood. And the body keeps this in an incredibly narrow, and I mean narrow, range between just 3.5 and 5.0. Even tiny little deviations outside of this window can cause massive problems. And this slide right here explains exactly why. If your potassium gets too low, that's hypokalemia, that electrical gap between the inside and outside of the cell gets bigger. The cell becomes even more negative, and that makes it sluggish and harder to fire. On the flip side, if potassium gets too high, hyperkalemia, that electrical gap shrinks. The cell is now resting way too close to its trigger point. It's twitchy, unstable, and dangerously easy to activate. So let's take a look at the real-world consequences of falling off this tightrope. What actually happens in the body when someone has too little or way too much potassium? First up, we've got hypokalemia, or low potassium. This is what we call it when the plasma level drops below 3.5. And it's actually the most common potassium disorder that doctors see. And it's usually not about just not eating enough bananas. The most common reasons are losing too much potassium through your kidneys, often because of medications like diuretics, or through your gut from things like vomiting or diarrhea. It can also happen when treatments like insulin cause a sudden shift of potassium from the blood into the cells. The symptoms make total sense when you remember that the cells are now sluggish and hard to fire. You get muscle weakness, cramps, in really severe cases, even paralysis.
And the most critical thing is what it does to the heart. You can get abnormal heart rhythms, or arrhythmias, because the heart's whole electrical system is just struggling to work properly.
Now let's talk about the other side of the tightrope, hyperkalemia, high potassium. This is when your plasma level gets above 5.0, and honestly, this can be even more immediately life-threatening.
The main reason this happens is that the body can't get rid of potassium, which almost always points to some kind of kidney failure. Another huge cause is a massive, sudden release of potassium from inside damaged cells. Think about what happens with severe trauma, bad burns, or a crush injury.
With hyperkalemia, the danger comes from those cells being too excitable, too close to their firing point, making them incredibly unstable. And while you can get muscle weakness here too, the number one concern by far is the heart. This hyperexcitable state can lead to life-threatening cardiac arrhythmias, and yes, even cardiac arrest.
And that brings us to the final and maybe the most crucial point of all. That potassium number you get from a blood test, that's just the tip of the iceberg. It's only showing us the tiny 2% of potassium that's floating around outside the cells. As the quote says, it's not always an accurate reflection of the whole story. For instance, in a complex state like diabetic ketoacidosis, a patient's blood test might show high potassium because the acid has forced it out of their cells. But, and this is the paradox, their total body potassium might be dangerously low. It's this mind-bending medical challenge. And it really reveals the truth. The body's electrical secret is hidden from plain view, forcing us to look beyond the numbers to understand the delicate, life-sustaining balance happening inside every single one of our cells.